Okay, so I hope this works. My name is Dané, and I chose to focus my PowerPoint on single parents with multiple children. Like I said, we're focusing on single parents with multiple children, mostly children under the age of 18 years old. Um, since the children are under 18 years old, this gives the parents a little bit more responsibility. They're going to have to do a lot for these kids, which makes them a little bit more vulnerable. Um, as we go throughout this PowerPoint, you'll see that I'll be referring to single mothers a lot because while I was doing my research, I concluded that most children who live in a single parent household are living in a household that is actually run by mothers. As you can see here in the PowerPoint, there's about 9 million single mothers in the United States. It's important for us to know that single parent families are at high risk for being lonely. They don't have anyone to share their problems with, and they are also at a high risk for a financial burden. And both of these issues can in turn affect both the parents and the children's well-being. So since these parents don't have any social help and they have low income, these parents are susceptible to health disparities as well as physical health issues and mental health issues. And we'll talk about these a little bit later on. So here just is the profile of single parents with multiple children. In Salt Lake, out of all the families, about 23% of the families are run by single parents. In Utah, it's about 19 to 20%. Throughout the United States, about 35% of the families are single parent families, and internationally, it's a lot less. It's about 14%. So the reason I think Salt Lake City is so significantly less than the rest of the nation is because of the religious views we have here. And those religious views go against divorce. So these parents, if they maybe are having a rough time, will try harder to stay together and make things work, and that way they won't be leaving their kids in a single family. Another reason I think it's significantly less is because Utah does have less natural disasters than other states. Other states, are going through hurricanes, floods, stuff like that, which could potentially kill one parent, leaving another parent in charge of the rest of the family. So there are two social determinants of health that I found that are a barrier to single parents. And the first one is going to tie in with the second one. So the first one I found is the lack of social support. So single parents don't have another parent to rely on. They also are super busy, so they don't have much time to go out with their friends, and that will take a lot of stress off of them. And so this lack of social support actually puts these parents at a higher risk for physical and mental conditions. Some physical conditions that not having the social support can cause is high blood pressure, heart disease, obesity, and a weakened immune system. Some mental conditions are anxiety, depression, Alzheimer's was on there too, and even death, which is pretty sad. So since we have all of these risks for these diseases, these patients should definitely be going in to see a healthcare provider to see if they have any of these diseases that need to be treated. And this is how we will tie in with the next slide, which is another barrier to single parents. And this barrier is access to healthcare services. These parents are going to have to either take themselves or their kids in to see if they have any underlying diseases, but since single parents only have an average salary of about $25,000 per year compared to about $80,000 of a family that's raised with two parents, their salary is significantly lower, which directly affects the choices that they make or are able to make regarding healthcare decisions. Since they don't make as much money, they probably are not going to want to pay for insurance. Down here I said that insurance per month per person is about $500, and for a family of four it's about $1,100, which is quite expensive. And if you're only making $25,000, that's a significant chunk every month. So I think what I found out is that a lot of parents will be like, okay, so what is the risk of not getting insurance for this month? Well, my kids probably aren't going to get sick this year, so I'm not going to get insurance. Then, when they do get sick, or when the parents get sick, they're going to have to pay out of their pocket, which is really expensive. And knowing that they have to pay out of their own pocket is another reason why they won't go to get these checkups that they need, because it is severely expensive. And if you don't get your checkups, you don't know what's wrong with you, and that can, as we all know, not have a good effect on our health. Some other concerns, like we said, there's about 9 million single mothers in the United States today, and single mothers have a higher risk of developing health issues than other mothers are who have a partner. And this goes for fathers too, I think. Just the information that I found was specific to mothers. These mothers have a 40% higher chance of developing cardiovascular health problems, a 74% higher chance of having a stroke, and are 77% more likely to smoke. And I think we can relate all of this back to stress. Stress is a big precipitator in cardiovascular problems, stroke, and is going to cause moms to smoke. Right here, I found out that the poverty rate for single mothers is 40% higher than those families where there's two parents. And out of those 40% of those parents, about 50% of them live in extreme poverty. When you live in extreme poverty, like I said, you won't be able to afford healthcare and stuff like that. And so these parents are highly susceptible, as we said, to anxiety, depression, feelings of isolation, feelings of helplessness, paranoia, and suicidal thoughts. So that's quite a big concern. The root cause for these health disparities that I found is a low income. Having a low income, like we said, is going to cause these parents not to be able to take care of their kids in a health perspective. Right here, I found that U.S. adults living in poverty are 5 times more likely to report being in poor health. And I also found out that you don't even have to be in poverty. All Americans at any income level reported poorer health than those Americans who have a really high income. So yeah, the biggest root cause for these health disparities for single parents is their low income. They just can't afford to go in to see their healthcare provider. So here we are doing Maslow's hierarchy of needs. I said that so most parents, single parents, try very, very hard to be able to feed themselves and feed their kids. I noticed that almost all of them say that that is their biggest worry, is to keep their kids fed. And then I also found out, so that means their physiological needs are met, they have their basic needs. Found out that about all these people who live in poverty use about 1/3 of their income to pay for their housing. So that way their physiological needs and their safety needs are met. But if those parents do go ahead and lose their jobs, they're not going to have those safety needs. That's why I put safety under met and unmet. And if we can't meet those basic needs and security needs, there's no way that those parents are going to go ahead and meet the psychological needs and self-fulfillment needs. So that's where I got my met and unmet from. And since they're trying so hard to make sure that themselves and their kids have these physiological needs, their functioning level is pretty low. They're trying so hard just to make sure that they have these basic needs. And therefore, they're trying so hard to just meet those basic needs. They are stressed, and like we said, stress causes disease. And then also that low income is going to also directly play a proportion into their health outcomes of chronic diseases. We do have some concerns here for communicable diseases and infections. Most people in the United States are vaccinated, but we do know that there are those that aren't vaccinated. So let's just say the parents are vaccinated, but they don't have enough money, so they don't vaccinate their kids, and then they don't keep up on their own vaccination. So that's going to put them at risk for getting the flu shot, because they're not going to get their flu shot every 6 months. They could be at risk for getting pertussis, diphtheria, because they haven't had their Tdap every 10 years. So it's important for those parents to keep themselves and their kids vaccinated so that they don't catch those diseases. If this parent does have a relationship with someone, a sexual relationship, it's important that they're educated on the risks of STDs, because if they're not, they could have a risk of contracting an STD too. And then we've talked about these non-communicable diseases and infections that these parents are at risk for. Like we said, they're super stressed, then they don't have social support, and they don't have enough money to go to see their doctor. So stress and the low social support causes them to be at risk for high blood pressure, high cholesterol, asthma, obesities, GI diseases, and then we have depression, anxiety, all that stuff. In a way that these parents should take time out of their day so that they can have some time for themselves where they can either meditate, relax, exercise. Just doing that kind of stuff has a very beneficial effect on the body and could help clear up those diseases or infections. Like we said, these patients need to go in to see their doctors so that they can get treated. But then we have the problem of the low income, so it just is a vicious cycle. They can't afford to go in to get seen, and so their diseases are just going to get worse and worse and worse, unfortunately. And then our last slide here, I think it's our last slide. Oh, second to last slide. Self-care and self-harm. Like we said, these parents have these mental health problems. They have anxiety, depression, chronic stress, paranoia, helplessness, suicidal thoughts, feelings of helplessness. So this puts them at a greater risk of self-harm. And like I said, these parents are so busy every day working and then coming home and taking care of all these kids, they have very little time to care for themselves. And this too is going to put them at risk for more diseases. I think this is our last one. The specific, so risk for harm to others or by others. So children in single parent households, 45 out of 1,000 kids said that they've been exposed to domestic violence from single families. This can happen because our single parents are divorced, and sometimes disputes can become physical, which can put both the kids and the parent at risk. And these kids also said that they have seen family fights become physical. And these kids that are exposed to this domestic violence have an increased risk of behavior problems, developmental problems, developing emotional problems, and have a higher risk for suicide. So although the harm by the parents is not intentional, harm is still done to others because of that fighting within the family. And then right here, I just have my references. So yeah, hope that made sense.